Hi, I'm Smita Negi on Fits on the Go blog and at ACC 2014 here at Washington, D.C. And I have Dr. Kim Williams, who is the President-Elect as of tomorrow for ACC. Thank you so much, Dr. Williams, for being here with us and taking time off your busy schedule. And it's an absolute honor to have you here.
Well, thank you. It's a pleasure to be here.
So my first question to you would be, as a president-elect for the year 2015, what would be your vision for ACC?
Well, as you know, ACC has done a lot of changing over the last 65 years. One of the major changes that we've done is actually to move international. We actually have a lot of chapters and a lot of fellows and a lot of trainees that are counting on us in their own home country to bring delivery of care, to bring new guidelines and ways of educating people to do the care that they do even better. While we look internationally, my strongest feeling is that we also have to clean up our own backyard, as it said. We still have issues of healthcare disparities, which run rampant. And we need to be able to improve the outcomes in women, particularly stroke, for example, and recognition of heart disease, minorities who have an incredible burden of complications from risk factors that we can control. So we need to double down on those programs and try to help our people here at home as well.
That's a great vision for 2015. So in terms of fellows in training, what would be your advice for fellows to make the best use of their time here in the conference to kind of work towards their development?
Well, needless to say, our digital strategy has resulted in a wide variety of abilities to be in multiple places at one time. And that's something that we should all be taking advantage of, whether we're in training, fellows in training, or attendings in training. We're all in training. Lifelong learning is a major principle of the college. And so we have the app that summarizes the entire program. You should be able to go through and pick out the things that you're most interested in. Whenever someone asks me to give career advice in cardiology or anything else, I always try to get them to follow their heart. Try to figure out what sort of thing can you do at 2 in the morning because you really enjoy it. And if you do that, you'll have a lifelong of happiness in your career.
So on a personal note, what is your most favorite event or session here at ACC?
Well, mine, of course, is imaging, and we had a wonderful session yesterday. It talked about multimodality imaging. We talked about radiation, and I am a nuclear CT guy, so of course ionizing radiation is what I do. But I'd like to do it better, and I'd like to do it with less risk, and to try to get it to apply to the right people at the right time. So imaging, that's just where I am.
Well, thank you so much, Dr. Williams, for taking time out today.